I'm Dr. Gaylina Reachi. Welcome to Tooth Talks. Today we are going to be talking about facial pain and habitual challenges that give ourselves face pain. We have a lot of muscles in our face and neck and head that when they become tense, unfortunately, it can make our lives pretty miserable. It can even feel like a really severe toothache. Now, there are a lot of muscles that we use. They're called muscles of mastication, and that is what allows us to open and close our mouths. There are muscles from here to the back, to our jaw, and to our neck, and they're all connected in this process. So when we hold tension in our neck, for instance, we can get facial pain. When we clench or grind, we can get facial pain. And sometimes it can be nerve facial pain. Some people will get something called trigeminal neuralgia, and it is a facial pain like an electric shock that'll shoot across the face. And for some people, this is a problem that is there almost forever, almost all of the time. If even air gets on their face, they have this odd electrical shock feeling. It can be incredibly devastating. And people who have facial pain, sometimes they cannot seem to manage it. We make appliances for them to hold their mouths open when they sleep to retrain those muscles. And sometimes we do muscle relaxers. Occasionally we do injections with Botox, and that will relieve some of the muscle fibers that can actually work to hold things together. I usually suggest to people that they make sure that their skeletal system is in line, right? Go to a chiropractor. Make sure you're having body work done. If you have tight muscles, have massages done. If you're under a tremendous amount of stress, we all have different personalities. So I always say you either need kickboxing or you need yoga. So you either need to eliminate that stress from your life through physical activity or through maybe meditation and a mental therapy, for instance, something that you're just doing for yourself to help you relax. We, of course, do medications like muscle relaxers and sleep inducers. Sometimes we do Botox. Sometimes we do electric stimulation on the face. We can also strip those muscles, and like a massage where you're really just trying to lengthen that muscle a little bit. And it's super important for us to figure out why and when. Why and when are you clenching? Is it when you sleep? Is it when you're stressed out, when you're driving, perhaps when you're concentrating? So if you are having facial pain and you'd like to talk to me about it, try to figure out a little bit about when and why you're doing it. I have musicians actually that tap constantly because they're keeping time with music. And it took us a bit to figure that one out. I wasn't expecting it. But I encourage you to ask yourself throughout the day, where are your teeth? And how are you posturing? When are you clenching and grinding? All those things. And then we'll talk about it.